My name is Siddharth Tambar, physician here at Chicago Arthritis and Regenerative Medicine, expert in rheumatology and regenerative medicine, answering your questions every Tuesday and Thursday, late afternoon and Wednesday mornings. This is purely for educational purposes, not meant to be personal medical advice. If you're interested in an evaluation, second opinion, review of your records, please direct message us or email us at admin@chicagoarthritis.com. for either an in-office evaluation or telemedicine. Heather, my daughter, just diagnosed with RA. Sorry to hear that. They started 3 meds. What can we try for pain? What meds did they try? They should be using medication that works to control the inflammation. Control the inflammation, that should control the pain. Now, it's possible for people to have some chronic discomfort even after inflammation is controlled, and then there's other options there. But to me, it sounds like your daughter's at the very beginning of this, and so they should be aggressively managing the inflammation. Zaida, I was diagnosed with Hashimoto's and RA. My doc gave me Plaquenil. I like this question because you can have more than one thing. And Hashimoto's patients can have other autoimmune issues as well. Your rheumatologist sounds like they're treating the RA with Plaquenil. Hopefully that's enough. If your Hashimoto's, if your thyroid is significantly underactive, your physician, your endocrinologist should be treating that appropriately as well. Sometimes very underactive thyroid can cause pain and swelling in the joints as well. I literally saw a patient like that today, where she has active Hashimoto's. I should really make content on this. She has active Hashimoto's, very underactive thyroid, and a lot of joint pains, and steroid responsive joint pains. And then the question is, what do you do next? In her case, I said, your thyroid is so underactive. You have to treat that before you consider anything else for inflammatory arthritis, because a lot of your pains may just completely go away with treating the hypothyroidism from your Hashimoto's. Sarah HNR7, what's a medication you take when trying to get pregnant with rheumatoid arthritis? I should make content on that too. I just made content on what medication can you take when trying to conceive or when pregnant with ankylosing spondylitis. Look, the ones, if your condition is active enough where you need to be in a biologic, Cimzia is the one that has the most data in terms of safety in the setting of pregnancy. Barbar Kirpatri, I have RA and I take Orencia injectables once a week. Is it normal to not have strength in my hands? That is not normal. If you've been on it for a while, the questions to ask are, number one, is the inflammation controlled? RA patients can get weakness in the hands for a few different reasons. Number one, if you've got chronic inflammation in the hands, very common to be using your hands less, and then suddenly you have some atrophy in the hands. Hand therapy can be helpful for that. Also keep in mind that RA patients are more prone to carpal tunnel syndrome. The reason why is that the median nerve runs through the wrist. If that gets pinched for any reason, and in RA patients, it can get pinched because if there's swelling in the wrist, it can compress the nerve. If that compression becomes chronic, you can damage the nerve. Damaging that nerve can eventually lead to some weakness in the hand as well. And so you could have atrophy of the muscles, you could have a pinched nerve there as well. Nikki Lawson, all test negative, but was diagnosed seronegative RA. Can you explain that diagnosis? Yeah. So 50% of people at initial RA diagnosis will be antibody negative. 25% will be antibody negative long-term. If you have evidence of inflammation in the joints, and it's in a classic pattern as RA, then it's RA, and you treat it appropriately. Life is good. Turmeric and ginger for RA. Turmeric is definitely helpful if you're talking about pain relief. Levin Trisket, 36, recently diagnosed with RA. My doctor says I'll need to go on methotrexate. That is the traditional first-line option for RA. It can make a huge difference in people's lives.